This is the Midday News on QTV. I am Gajaga and thank you for joining us. And now here are the main local and other news headlines. The Permanent Secretary of the Ministry of Foreign Affairs, International Cooperation and Gambians Abroad has spoken at the International Migration Review Forum in New York about the Gambia government's efforts in tackling irregular migration. Riders for Health Gambia handed over 30 new motorcycles to the Ministry of Health for outreach health workers in various parts of the country. The Village Development Committee of Amdalai has taken up a development initiative of installing solar or street lights along the highway to ensure safety and security of residents and traffic. A fire outbreak at Pajokunda Health Center destroyed several units of the health facility on Friday evening. Also, another fire outbreak on Thursday evening consumed 5 apartments near the Serekunda Sandika market, leaving several families homeless. Those were the main news headlines, and now the news in detail. Welcome and thank you for joining us. This is the Midday News on QTV. The Permanent Secretary of the Ministry of Foreign Affairs, International Cooperation and Gambians Abroad, Safi Sankare Faraj, has spoken at the International Migration Review Forum General Debate in New York about the Gambia government's policies, steps taken and gains made in tackling irregular migration and making migration safer. More in this report. Safi Sankare's speech mainly focused on the Gambia government's policies, trends, gains and steps taken to make migration safer, and hailed the forum for bringing together government and key players to share ideas on migration.
My delegation welcomes this intergovernmental global platform to review, discuss and share experiences in the implementation of the landmark Global Compact for safe, orderly and regular migration since its adoption 3 years ago. It is also a good opportunity to leverage the contribution of migration in the implementation of Agenda 2030 for sustainable development, particularly in this decade of action.
Sankare Faraj also highlighted some of the challenges associated with irregular migration, including human trafficking, exploitation, and abuse, amongst others. According to her, the Gambia government will evaluate its policies to address these challenges.
We're equally aware of the enormous challenges associated with irregular migration, including the immeasurable human and social costs to our country, as young people become victims of human rights violations, exploitation, abuse, including psychosocial trauma, in their journeys. They also encounter a lot of difficulties in accessing services to address their protection needs upon their return.
Migration has some economic gains. More than $500 million of remittances sent via official channels was recorded in 2020, which has increased close to $700 million for the whole of 2021, according to the Central Bank of the Gambia statistics over the last 2 years. Sankare Faraj says her government recognizes the impact on sustainable growth of well-managed migration.
Migration is an important component in our national development agenda. The Gambia is a proud member of the GCM champion countries, and we fully associate ourselves with the statement read on our behalf this morning. Madam Chair, the Gambia fully recognizes the inextricable linkages between migration and development, including its potential as a key driver for improving the lives and livelihoods of Gambians and the socio-economic development of our country.
The International Migration Review Forum took place from the 17th to the 20th of May 2022 and was hosted by the President of the UN General Assembly. The aim is to review the progress made at the local, national, regional and global levels in implementing the Global Compact for safe, orderly and regular migration. The forum is of special relevance to Gambia, as the country has one of the highest number of irregular migrants per head of population in Africa. Gajaga, QTV News. Riders for Health Gambia handed over 30 new motorcycles to the Ministry of Health to replace the used fleet of motorcycles by outreach health workers in various parts of the country. More in this report.
The handing over is in line with a contract agreement between Riders for Health Gambia and Ministry of Health that requires for the replacement of transport that become economically unviable. Part of Riders for Health core priorities is to minimize road traffic accidents and increase awareness of road safety. Usman Yabo, Chairman Board of Directors Riders for Health Gambia, advises the beneficiary to be cautious and encourages the frequent servicing of the motorcycles.
In terms of movement, vehicles, we have given out TAM vehicles to the Ministry of Health, and they are right now in use. It's important that you pay attention to the traffic. We have so many so-called qualified drivers, and you cannot imagine a motorbicycle and a vehicle on the road. I want to caution you, those who are going to use these motorcycles must be very careful.
Mustafa Bite, Director of Health Services, thank Riders for Health for their partnership.
I am happy with our relationship, with how we give priority to our ambulances to ensure that they are always on the road and to always be able to be very flexible with us. You could see that there seems to be a big improvement. It's not only replacing like with like, and it looks like the bikes are sturdier, stronger, and they will last long. So I think this is what the partnership is about. We appreciate that and we thank you.
As road traffic accidents become infrequent and worrying, beneficiaries also receive protective gears. Alhaji Sankare, Regional Director of Health Service Western Region 1, implores the beneficiaries to be responsible while using the motorcycles to avoid accidents. He also thanked Riders for Health for their immense services over the years.
It is significant to ensure that if you don't have mobility, access to service provision becomes a nightmare. We have registered some history of motorcycles being stolen from Ministry of Health vehicle, fleets, and I want to inform you and remind you that you have to be very cautious in the way you handle these motorcycles.
Mensa Job, a public health officer and a beneficiary, had this to say.
Express our gratitude to the entire team that facilitated this fleet of motorbikes. And we know that these motorbikes go a long way in assisting us in offering our community services, ranging from surveillance, issuing primary healthcare services, environmental inspections, and many other activities.
Riders for Health was established in the Gambia in the early 2000s with the core mandate to enhance transportation systems within health-focused organizations in Africa, with a vision to live in a world in which no one will die of an easily preventable or curable disease because of the barriers of distance or poverty preventing them from being rich. Ajibintu Drame, QTV News.
Lightening up a border between Senegal and the Gambia. The Village Development Committee of Amdalai has taken up a development initiative of installing street lights along the highway to ensure safety and security of residents and traffic. Mudulamin Choi report from there.
A development facilitated by a Village Development Committee working to give a facelift to Amdalai, a Gambian border village with Senegal. With street lights mounted on these poles, the VDC has lit up part of a highway in Amdalai, stretching from the border to Bara, which used to be in darkness at night. The community rejoices with an overwhelming gratitude to the initiative. Mustafa Mbejov is the VDC chairman.
If you look at it, here in Amdalai, it's like when you are leaving Amdalai and entering Senegal, you realize no one should tell you, in fact, where the border lies. Because the moment you enter Senegal, all that you see is light. It's completely different. When you are also entering the Gambia, no one needs to tell you where the border lies. The moment you enter Amdalai, it is all darkness, up to Bara. So this is what we need to change.
Amdalai is one of the busiest border posts in the Lower Niomey district of the North Bank region between the Gambia and Senegal, recording hundreds leaving and entering the country daily.
It was also something that we liaised with NAWEC such that they allow us to mount the lamps on the poles. This also we have to thank them, and we also need to call on their management to at least look into the issue of the street lights that are within the community. Those ones are not working, so we need to change that. And also apart from that, the other parts of the community, the village is developing. So we have so many compounds in Amdalai here that still need electricity, but due to the fact that the poles did not reach them, they can't have it. So we also want this thing to be addressed as soon as possible.
An estimated 3,000 plus people live in Amdalai village. Safety and security are important issues of concern for the residents. Father Faye is among the residents who have found some safety and security since the street lights were installed.
The
street lights have been very useful to us because before, whatever you place around, the thieves would steal, be it chickens, goats, and other things. But now you can see anyone. Another thing we want is for the government to help by giving us an ambulance. Amdalai has no health post, and an ambulance will help transport patients to and from hospital.
Another problem facing Amdalai is the absence of speed bumps on the highway. As a result, the road has seen fatal accidents.
So the same day, bala ñu wax 24 hours sa benen accident xewaatoon na bo demee ci kanam bo dugg ci boori poste bi rek benn taxi.
Less than 24 hours, there was another accident in the village caused by a taxi that was overtaking another vehicle, hitting at least 7 cows. One was pregnant, but thanks to the services of vets, the cows are surviving. If you look at it from here to Bara, it is only Amdalai that does not have speed bumps. A few days ago, representatives of the National Roads Authority visited the village to conduct a survey for the possibility of constructing speed bumps in the village. The Village Development Committee is anxiously waiting for the NRA to take further action to ensure traffic safety for the residents and livestock that bear the brunt of reckless drivers. Mahmoud Lamin Choi, QTV News.
We will now go for a short commercial break, and when we return, we still have some more local news stories for you. Do stay tuned.
It's happy time. Get 50% off all calls to any network. Enjoy calls every day to any network from 6 a.m. to 10 a.m. Is it too good to be true? QCell. We innovate, others follow. Your favorite QCell service has gotten bigger. eFunkanta. Now you can loan bigger credit amounts to make life easier for you. Loan $75 and $100 and pay later. Yes, you heard me right. Get credit loan from $10 to $100 using eFunkanta by dialing *393#. Anytime you run out of credit, whether you want to buy Q-Power, browse the internet, make urgent calls, or send SMS. eFunkanta is the service for you. Dial *393# and choose the loan amount of your choice with no hassle. For more information, call our customer care on 111. QCell, Sunyabus, the pioneers of mobile loan service in the Gambia. We innovate, others follow. Terms and conditions apply.
Welcome back, and thank you very much if you're just joining us. This is the Midday News on QTV. A fire outbreak at Pajokunda Health Center destroyed several units of the health facility on Friday evening. QTV team visited the scene, and this is the report by Lamin Dabo.
The units affected by the inferno include the reproductive, child health, public health office, the pharmacy, and the vaccine storage room, causing huge disruption to service delivery at one of the busiest health facilities in Kanefi municipality. Ramatullah Kamara, the officer in charge of the health center, explains how the incident happened.
One of my staff called me to say that there is a fire outbreak at the back of the RCH. Then I went to the scene. I just see a huge fire outbreak at the back. So thank God the community came on board. We called 118. this is a major facility, and we cover over 3,000 people, inhabitants of this facility. To resume work as soon as possible, we need help from philanthropists. Any donors outside need to come on board to help. It will be very effective for us, because we cannot stand still without the work going on.
Alhaji Sankare, the Regional Health Director for Western One Region, who also visited the scene, said the incident is unfortunate, as the health facility serves many communities daily due to its strategic location.
Just have to thank the population of Pajokunda and beyond, the staff and the neighbors for giving their time and energy to swiftly put out the fire, of course with the support of the Gambia Fire Service and Rescue Services. This is the most important service delivery of this facility. I would say is the nucleus of the facility, is the RAMCA services. And when we say RAMCA service, that's the reproductive, maternal, child, neonatal, and adolescent health service delivery department. That's where the fire outbreak occur. And currently where we are definitely desperate to see that services continue. With the situation at hand now, we are calling on donors and UNFPA, UNICEF, WHO, and all our goodwill partners, to give a helping hand to ensure that services are restored at this particular place. And this is where you have the immunization service delivery taking place. That's where we have our EPI services, the vaccine storage facility, the pharmacy, the antenatal service delivery, and that's where the cervical cancer service delivery is also taking place. So by and large, this is the nucleus of the health facility. And currently with this fire disaster here, if we have to leave it as it is now, I know ministry, the region and the facility will be doing everything humanly possible to ensure that we are able to restore services here. But it requires some cost. And we are calling on all Gambians, home and abroad, to see how best they can, help the Minister of Health to definitely restore services at this facility.
Although some have attributed the cause of the fire to poor electrical installation, it is still unclear, and an investigation is underway to ascertain the cause. What is clear now is that there will be a huge disruption to effective service delivery at the health center. For QTV News, I am Lamin Alaifandin Dabo.
Well, another fire outbreak on Thursday evening consumed 5 apartments at the compound near the Serekunda Sandika market, leaving several families homeless. Though there were no fatalities, the incident has left several families homeless. QTV's Ansumane Sonyasi reports.
Blamed on frequent power outages that appear to have intensified in the past couple of days, the incident has left occupants of these apartments devastated. With no shelter, food or clothing, they are left hopeless except for the benevolence of neighbors who come to console and sympathize with them. The debris of what is clearly a distressing incident can be seen everywhere. Amara Jaguraga, one of the victims, explains how the incident unfolded and attributes the cause of the fire to frequent power outages.
On and off, because Olungo, on and off theater bakele.
That day, power was going on and off a lot. It happened many times that day, and all within a very short period. All the rooms caught fire at once, and this happened at a time when all the occupants of these rooms were at work, except my brother, who was having his bath. He had to run for his life after smoke engulfed the whole building.
Sira Jalo, one of the victims, could only manage a few words.
I am seeking help. I have lost everything.
Anyone willing to support them can contact QTV. Answane Sonyasi for QTV News.
Now, before we end this news bulletin, here is a recap of the main news headlines. The Permanent Secretary of the Ministry of Foreign Affairs, International Cooperation and Gambians Abroad, Safi Sankare Faraj, has spoken at the International Migration Review Forum in New York about the Gambia government's efforts in tackling irregular migration. Riders for Health Gambia handed over 30 new motorcycles to the Ministry of Health for outreach health workers in various parts of the country. The Village Development Committee of Amdalai has taken up a development initiative of installing street lights along the highway to ensure safety and security of residents and traffic. A fire outbreak at Pajokunda Health Center destroyed several units of the health facility on Friday evening. And another fire outbreak on Thursday evening consumed 5 apartments near the Serekunda Sandika market, leaving several families homeless. That's it for the Midday News. Thank you very much for watching, and join our QTV News team again for the 8 p.m. news.